Hey everybody, it's Joel here down in the cavern of VFSV. Going to talk to you today a little bit about acute neck pain, stiffness, lack of range of motion in the neck. Very common problem. In most cases, it tends to be musculotendinous in nature. A classic scenario might be you go to bed at night feeling great, wake up the next morning after sleeping a little cockeyed or in one position for too long, and suddenly you can't turn your head. Everything's seized up. There's a lot of acute neck pain. Sometimes it even creates radiating pain into the head, giving you a headache. You know, you can't turn, you can't back up your car, all that good stuff. Another classic scenario, spending too much time at a computer. You know, you're just banging away at your keys and you've got your head just pitched a little too far forward for too long. Everything again starts to seize up, and then before you know it, you've got acute neck pain. Sometimes it's something as simple as you turn to talk to the person next to you. Maybe you've been sitting in a position or in a static position for a length of time, then you turn quickly to speak to somebody, and boom, you tweak something. Again, the muscles seize up, you get a lot of spasm, really interferes with your, not only the pain level, but your ability to turn your head, rotate, move. So in most cases, there are three big culprits in the neck, three structures that are really creating a problem. One being the neck extensor unit, the deep neck extensors and rotators, especially where they attach right up at the base of the skull. A lot of times in that base of the skull area, that's called the suboccipital region, you'll get a lot of spasm, inflammation, tension. There are some very important nerve fibers that pass through that area, so you can also end up getting a lot of radiating head pain, so headaches. Sometimes you'll get things like even some numbness and tingling up into the head and face region. That's all part of suboccipital neuralgia, but the source is generally the neck extensor unit that attaches in there. The muscles get too tight, too spastic, too inflamed, too swollen. Everything gets pinched and bound up and creates all kinds of problems. Second place is the upper trapezius. Most people, if you poke them at the top of the shoulder here, between the shoulder and the neck, you will find not only are they tense in there, but they are also very tender, and there's a lot of pain generating from that area. That is a high tension area for a lot of people. A lot of people hold their stress up there in their shoulders. They get what we call the turtle syndrome, where it looks like, they're pulling their head into their shell, right? So the shoulders are way up here, the neck crunches down, everything's tight up there. And that can be a huge source of neck pain, spasm, inflammation, lack of range of motion. Those are also really big, powerful muscles. These are muscles that have to hold your head up all day. And believe me, this melon up here, it gets pretty heavy, and holding up all day is a lot of work. So they're postural muscles. They work all day long. And so they get a lot of abuse, and they can start to develop all kinds of myofascial issues. Third spot can be the Levator Scapula, which runs from sort of the top corner of the shoulder blade and runs up and deep into the neck. It is responsible for helping to move your shoulder blade. It also acts as a neck extensor and rotator. So if that seizes up, suddenly, boom, you're locked and you're doing the Herman Munster kind of thing, unable to turn your head. So we're going to talk about those three structures and simple things you can do at home to start helping yourself out. Let's start with that suboccipital area. First thing I'm going to have you do is we're going to use your thumbs. And the easiest thing, so if I'm having a lot of pain and irritation on the right, I'll use my right hand. I'm just going to palm the back of my head here. Okay? Palm the back of my head. And then I'm going to use my thumb and dig around and identify those tender spots. Bang. Once I identify the tender spot, I'm gonna just practice just giving myself some deep pressure right on that tender spot to tolerance. You don't have to kill it, okay? Just to tolerance. You're at home, you're able to do this, so what you have working in your benefit is frequency. You can do this a lot of times during the day. You don't have to run into your therapy office, your chiropractor's office, your massage therapist's office. You can do this at home, and you can do it 2, 3, 4 times a day. So you don't have to kill it. Work it gently, but work it. You're gonna have to dig a little bit, okay? So you're gonna have to feel it. So palm the head, take the thumb, stick it in that suboccipital region. Right there, right? Okay? And then what you're gonna do is just gently press in, press, hold the pressure for about 10 to 15 seconds, and release. So again, we're gonna press, hold 10 or 15 seconds, release. Repeat that maybe 3 or 4 times. The next thing is to do the same thing, but this time we're gonna find that tender spot and trap it with your thumb, and then just gently skitch around with your head. If you're all spastic, you're not gonna have a lot of range of motion, right? So it might just be some little wriggles. You can go side to side, you can even go up and down, like nodding your head, okay? So we trap it, find that tender spot, I trap it with my thumb, and now I'm just gonna sort of gently wriggle around and scrub on that. Just scrub that area and work that. Maybe I'll do a few back and forth, a few up and down. I'll turn around here in a second. It's hard for you to hear me when my back's to you, so let me show you. So side to side, up and down. Here we go, show you from the back. Okay, so that's how you do that. That whole process, spend maybe 2 to 3 minutes. That's it. You know, don't spend an hour. 2 or 3 minutes, move on. If you've got problems on both sides, then obviously do the other side as well. What you may find is one side is a lot worse than the other. Most times that is kind of what we find. One side is worse than the other. If sometimes the neck is so seized up, it's hard for you to get back here. It's just hard to get your hands up there. So if that's the case, or if you just don't like using your thumb, we're gonna use one other little tool. Ball. This is just a tennis ball. Tennis ball works great. If you find the tennis ball is too soft, although for most people when they're acute, it's just fine. You can also use a lacrosse ball. I've sometimes had people use a baseball, but with a baseball, watch out. The seams can sometimes rub your skin a little raw, so just be careful. I like tennis ball. Works great. Perfect size. Okay. What you're going to do is take that tennis ball where I had my thumb. Boom. Where I had that thumb, we're going to now place the ball. And you can do it a couple different ways. I find normally, initially, it's best to do up against a wall. You can do it laying on the floor as well, but the weight of your body weight and your head pressing down is sometimes it's just too tender. So, sometimes it's best to do it against the wall, at least in the beginning. Okay, so you take the ball, put it where my thumb was. I'm gonna find that spot, then just trap it up against the wall. And now, again, first, maybe 10, 20 seconds, just press and relax. Press and relax. Do 3 or 4 repetitions. Then press it. Now, same thing as we did before. We're going to just scrub and skitch around, just scrubbing it, just rolling it and scrubbing it. Maybe go up and down, and you can just play around, go different directions, move into different spots if you want, move around, scrub, scrub, scrub. And again, the whole process should take you about 2 minutes. Okay? That is the first step. Step number 2, let's work on the trap. We're going to use claw hand. Claw hand. So if you're doing it just manually, no tools, claw hand. You make a claw, poke around, find that trap. Once you do, press down. So I'm basically pressing down into the trap. Again, you're going to find you probably won't have to use a lot of force. press down, hold it for about 10 or 20 seconds. If you want, you can do this sitting. Nice if this arm can rest a little bit. It just softens that up and you can press down, okay? We'll do the same kind of scrubbing routine too. So first you press down, hold it for about 10 to 15 seconds, release it, catch a breath, go back with the claw hand, find that spot, press and hold, give it 10, 15 seconds or so, release it, shake the arms out, okay? Go back again, right? Maybe 3 or 4 repetitions. Then let's do the scrubbing. So again, you're gonna find those tender spots wherever they are, boom, oh, there it is. Press down. Now just with the head, again, gently rotate back and forth and scrub away at that thing. Maybe a few repetitions side to side, a few up and down, boom, 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 scrub away. Again, doing it for about 2 minutes. Done. Same thing on the other side if you need to do the other side. If you want to use a tool, I like this little doohickey. Boom. That's called a back knobber. There are other things similar to this. Theracane is another one. Okay, I've had actually some people use the handle of the hook end of a umbrella. Okay, the advantage to this is it keeps you from having to reach way up here, which does tend to create some tension. So here you can get it on that trap, right? And press down here. It's a little, I find it's a little more comfortable for your upper body, okay? Might be a little easier. But same thing, you trap it, just do the 10 to 15 second holds, release, trap it, 10, 15 second hold, release. And then you can also do the scrubbing same kind of way, right? Boom, scrub away for 2 minutes, okay? You can actually use this for that suboccipital region as well. Basically, you get it, you find it, boom, and now what I'm doing is I'm sort of pulling the knobber forward, right? Digging in, pulling, bang, scrub away as well, okay? Another option would be to just gently lean into it against the back of the wall or the door, in my case, right? So that's a great little tool if you have one. If you're in a pinch and you don't have it, don't freak. You can use your hands. You can use the tennis ball, okay? All right, so moving on. Next one is the Levator Scap, which again, tends to be somewhere between the shoulder blade and the upper part of your neck, in here somewhere. Again, you can use the claw hand. So get down closer, you'll find the blade, the shoulder blade sticking out here. Dig around in here and usually, boom, right in that little corner somewhere. A lot of times you'll find that spot. It's the same process. Process is no different. Claw hand it, boom, trap it, press it, dig in, give yourself 10 or 15 seconds. And yeah, it's tender. It kind of sucks. You're hurt. The tissue isn't normal anymore, right? It's gonna hurt. It's gonna be tender. So gauge your pressure based upon your tolerance, what you can handle. Press in, give it 10, 15 seconds, release, right? Go back, do it a few times. Scrubbing technique once more. Here, right, we're gonna just scrub away and move around. Basically what you're doing is you're trapping that little tender spot, and now you're moving that muscle, and it's kind of breaking up all that adhesed material, all those toxins, just trying to flush all that garbage out of there, okay? Again, if you had a back knobber or a Theracane, you could use it, you find it, bang, you trap it, and now I'm just sort of pulling down into my body with it, trapping it. Again, we can scrub as well. Oh, I found a spot on me right there. Oh, yeah. Oh, well, I got to do this myself a little bit, I guess. Okay? So, another little tool there. Also, you could do it with your ball. You find it, right? I find that spot. I pin it up against the wall here. Bang. Oh, and then I just sketch around on it, scrub away. Okay, so there's several options for working those three sources of this problem. The neck extensor area, right? Here, palm the head, dig around, right? The upper trapezius, which runs from the tip of your shoulder, runs all the way up, goes up the whole length of your neck, right? Dig around, claw hand it, work it with the claw hand, right? And then the levator scap, which is from the corner of the shoulder blade and runs on up here into the neck. Dig around, especially towards that shoulder blade. A lot of times that's where you'll find it a lot, is in there. Claw hand it, bang, got it, dig away, right? Okay? So those are a few things you can do, just manual. This is what we call manual release or active release, okay? Where we're trying to release some of that tension and some of that buildup. Now, let's do just a couple of simple, and I do mean simple, exercises just to try to free things up. At this stage, if you're acute and things are all spastic and inflamed and you're really restricted with your motion, you can't do anything too aggressive yet. You got to give that tissue a chance to sort of rebound and start to make progress. Otherwise, if you throw too much at it too soon, the body's instinct is to fight back. So you want to keep it simple, but you want to start trying to get some blood to circulate and getting those tendons and muscles to ease off and back off so you can get some range of motion. For the traps and the levator scap, one simple exercise is a simple reverse shoulder roll. So all you're going to do is slowly roll up, back, and around. And don't be surprised here too. Sometimes things will snap and pop. Don't be surprised if your shoulders pop, if you feel little pops and snaps in the neck, maybe even the upper thoracic area. So from the back, just so you can see what it looks like, shrug it up, around, and back. Slow, controlled. You're not trying to do anything too aggressive. You're just trying to find a rhythm, just a nice circular rhythm, okay? That's exercise number one. Let's try cervical lateral bending. The biggest restriction for most people will be the rotation and the lateral bending, right? They'll lose a lot of that. A lot of times you maintain this, but this and this seizes up very quickly. So let's do lateral bending. So if I was really experiencing pain on the left, this is how I would do this. Take my left hand and I'm gonna hold it behind my back. So here's my left hand, right? Hold it here. Take it, boom, extend it down here. Stay nice and upright. Squeeze your butt, stay tight here, okay? And now what we're gonna do is with that arm trapped, just gently, to whatever degree you can manage, start tipping your right ear to the right shoulder, right? This is now stretching this trap out, this trap, okay? So from the back, boom. And that's how I would do it. I would lateral bend, pause for a few seconds, not too long, come back to neutral. Always come back to neutral. Never, never go from one side all the way quickly to the other side. That's a good way to trigger a spasm. It's a good way to strain things. So we never do this kind of thing, right? What you want to do is tip to the right, pause 2 or 3 seconds, come back to neutral. Tip to the right, pause, neutral. While I'm tipping this right here, I'm kind of doing this kind of thing, right? Here. That traps that shoulder out here so that we get good leverage on that trapezius. So we're pressing down, tip to the right, tip to the right, back to neutral, okay? To get to the levator scap, we're going to add a little tweak to that. So same setup. I'm working the left side. I'm trapping the left arm. Boom. But now what I'm going to do is I'm actually going to rotate a little to the right and tuck my chin down here. So notice the difference. The upper trapezius, I look straight forward. I tip the right ear towards the right shoulder. Okay. The left levator scapula, that's the one I'm after. I rotate first and then I tuck sort of away from that left shoulder. So, and go easy, because what you may find is you can get to one position and then you start to go and you feel that little grab, right? So easy. And again, I'm taking that arm and I'm sort of pinning it and trapping it, that left arm. So again, the levator scap is here, a couple seconds, come back. Again, a couple seconds, come back. I don't know. Use your instincts. 3, 4, 5, 6 reps each exercise, right? Okay. If you need to do both sides, do both sides. Okay. Do a few reps on each side, right? The last one I'm going to show you, rotation. Again, same setup. If I'm working the left, I'm trapping the arm, boom, trap it. And now what we're doing is we're just gently rotating like I'm trying to look over my right shoulder. So slowly go to that point where you feel things catching the neck. Stop for a few seconds. Come on back. I only stop for 2, 3, 4 seconds. It's not long, right? Turn, hit it. 1001, 1002, 1003. Boom, I'm back to the center. Rotate, 1001, 1002, 1003. Boom, back to the center. Okay, and again, 3, 4, 5 repetitions one way, 3, 4, 5 repetitions the other way. You know, there's no set number. Do what you can do. The more time you have, work a little more. If you're rushed for time, work a little less, but then go back and maybe do it again later in the day. So you could do these exercises a couple times a day. You could do them earlier in the day and later in the day. Do a session in the middle of your day, especially if you're working all day. Maybe you break up the day and do something in the middle of the day. So this is a simple way to start managing some of your own acute neck pain. Once you get out of that acute phase and you get some of that range of motion back and a lot of that acute pain starts to die down, then you'll do some other exercises to try to strengthen your neck and other sort of ergonomic things you can do to help break up the monotony of your workday so that maybe you can prevent some of this stuff. But those are different videos on my channel and you can go check them out if you want. But for this video, this is for acute pain. So this is for when you're really hurt, okay? So those are a couple things. Try them. See how things go. Obviously, go easy. Here's one rule I give you. I like to always sort of recommend that you always work to the point of pain, but not necessarily through the point of pain. So if we're working on rotation and I've got that left arm trapped and I get to 30 degrees rotation and I get that little grab in my neck and I feel like, oh, I'm hitting the wall, I don't necessarily try to force it to go past that point. Just work to that point. 1001, 1002, 1003, come back to neutral. Go to that point, 1001, 1002, 1003, come back. If you try to push through the point of pain, again, your body's reaction is to clamp down and fight against you because its instinct is it doesn't want you taking it past anything it can handle and further irritating it. So it'll fight you. So if you keep working to the point of pain, to the point of pain, to the point of pain, eventually what happens is the point of pain moves further out. And slowly but surely, you start to see greater range of motion return. So use that principle. Work to the point of pain, but don't try to push through it. And I think you'll see that you'll have more success that way. It may take a little while. Listen, I'd love to tell you you're going to do these exercises one time and poof, everything's going to be great. Most injuries don't work that way. You got to work them back. So be patient. Work to the point of pain, not through the point of pain. Do these a couple times throughout your day and start seeing if you can get some of that range of motion back. So I'm Joel. This is Vintage Fitness. We're down here in the cavern Hope this is helpful. Check out my YouTube channel. That's VFSV, Joel Palmer. Go there. There's a whole slew of other rehab videos there and workout material. Everything's free. It's just there for you to check out. Hopefully this helps you out. Give me a thumbs up if you watch this video, and most definitely give me a thumbs up if you use these techniques. So, Joel Palmer, Vintage Fitness. We're out. Good luck. Check back for more videos. Thanks. See y'all.